Hi there, it's Uzo here, okay, from Integrated Clinical Strength and Conditioning. So today's call to action is all about attentional focus and external cueing, okay, around skill acquisition and how we can improve skill acquisition for our patients. So what we're going to do is we're going to outline some of the theoretical underpinnings that are associated with attentional cueing, and also outline some areas of good practice that you can apply in the clinical setting tomorrow. So, first things first, what is attentional focus, I hear you ask? Well, let's go back a step and let's check out skill acquisition. So, motor skill execution, often what it requires is some cognitive focus from the patient, i.e. they need your attention. So, a bit like I've got your attention now, okay? Your patient needs your attention in order, okay, for them to take in the verbal instructions that you're giving them, and also the feedback that you're giving them, okay, on the execution of their movement. So research really is telling us that motor skills are enhanced, okay, if we apply, okay, an attentional focus to their training and also the instructions that we use and also give to our patients. Now, so from an intentional focus perspective, okay, it can either be internal or it can be external. So, which is which? In essence, okay, we've got external cues and we've got internal cues. Now, as physical therapists and physiotherapists, we're very much used to internal cues. We're very much used to cueing our patients internally to do things. So, in essence, let me give you a very good example. So an internal cue, in essence, okay, gets the patient to focus on either some particular body part or some internal bodily sensation. So for example, you might say, for example, if you want someone to stand, you might say, okay, put your feet down, and what I want you to do is I want you to push with your feet to stand up. That's kind of an internal focus, because we're getting the patient to think about their actual body parts. Now, there may be use and utility in doing that, okay? And there are times when you want to do that, especially when you're teaching something that's relatively new and the patient has absolutely no idea, okay, what this particular skill is. Equally so, it might be something along the lines of, what I want you to do is I want you to squeeze your glutes, okay, as you do this single leg squat, or as you contract this muscle with a TheraBand or a weights machine or whatever it may be. But I think you can see, in essence, what it is the internal cue is all about the patient's body or the bodily sensation that they should be feeling. Now, an external cue is actually just that, it's external to the body. Okay, so, and I guess the focus is on the outcome or the goal that we want the patient to achieve, yeah, or some other environmental variable which is actually outside of their body. So for example, if you wanted someone to get out of a chair and you wanted to get out of a chair relatively quickly because you wanted to improve their rate of force development, you might say something along the lines of, what I want you to do is I want you to explode out of that chair. Or for example, you know, if you were given someone an exercise, okay, with a band, okay, and you really wanted them to generate large amounts of force, okay, or the highest amount of force that they could tolerate, okay, you might say something along the lines of, well, what I want you to do is I want you to snap that band. Come on, try and break that band. Then that, you can see here, it's the end outcome goal is important. It has nothing to do with actually the patient's bodily sensation or their particular body part. And that's the key difference between an internal cue and also an external cue. So why is attentional focus important? And for some of you, this may be the first time that you're hearing about it. Certainly for me a few years ago, it was the first time I'd really even considered it. Well, really, we've got a plethora of research. We've got about 40 years worth of research, okay, to underpin the effectiveness of external focus or external cueing. Okay, one of the key workers in this area is a scientist called Gabriella Wolf. Okay, she's got loads of papers, but fundamentally what it's actually saying is when we compare an external attentional focus to an internal attentional focus, pretty much across the board, okay, with a few exceptions of course, okay, external attentional focus is generally superior to an internal focus for skill acquisition and also for motor learning, and most importantly, the retention of motor learning. Yeah, so making stuff stick with our patients, which ultimately is what we want, clearly. So for the academics amongst us, okay, what's the underlying theory? Well, in essence, the underlying theory is the constraint action hypothesis, or the constraint action theory. And basically what it says is, or what the underlying principle behind it or thinking is, that if we use an internal focus, it constrains the automatic motor pathways and can interfere with our automatic processes. So it causes basically some cognitive interference, basically because the patient's having to really think quite hard about it. Okay, so their attention is taken elsewhere. And think of it from a practical example. Okay, so when a patient comes in to see us on a day-to-day basis, okay, it's not, the physiotherapy isn't the only thing that's on their mind. Yeah, so that isn't the only thing that has their attention, because we said attention was important, didn't we? So they may have come in from work, they may have come in from home, there may be stuff happening at home, they may have to go to somewhere else after their physiotherapy appointment with you, they may be concerned and worried about various different things, so their attention is being taken away by other extraneous variables. So we can't assume that actually when they come to see us, okay, and we're trying to improve their skill acquisition, or we're trying to improve their motor control, or some type of skill type related problem, we can't assume that actually all their attention is with us, because it isn't. Often their attention is elsewhere. So what we're trying to do is we want to make it as implicit as possible. So we have two different types of pathways. We have implicit pathways and we have explicit pathways. An explicit pathway is quite deliberate. Okay, it's kind of knowledge of rules, facts. The key thing here is it's cognitively very, very, very heavy, okay, for anybody to really use this information. Whereas actually, when things are implicit, it just happens. Yeah, and we've all seen beautiful movement when it just happens, and that's what we're looking for. How can we effectively use our cueing to make things just happen, to make it explicit, so the patient organizes themselves. They're able to self-organize. It's subconscious, it's innate. Yeah, all of the things that we want to happen with movement, beautiful movement, often just happens. You see it, doesn't it? It just looks great. It looks pleasing. It doesn't look like, the patient has spent, 4 or 5 minutes thinking about it in order for it to happen, because that's just too much cognitive demand. So I think a little bit of practical application here. So there's a guy who's really one of the leaders, I guess, in terms of the practical application of some of this external cueing research. His name is Nick Winkelman. Okay, he's got a great book out. Okay, it's called The Language of Coaching. It's absolutely beautiful. It's really amazing. Okay, but essentially, Nick, what he does, okay, he goes through essentially 3 things that you can use on a day-to-day basis with a patient, okay, to improve your external cueing, okay, to improve skill acquisition and also learning, but most importantly, the retention of that movement. So he talks about 3 things in essence, okay, and essentially what he says is actually if we apply these 3 things within our language, within the language that we use with our patients, that we can improve selective attention. And this is the key thing. Selective attention. I've already said that actually our patients have loads of things that are effectively, okay, trying to steal their attention, okay, when they come in to see you. So we need to effectively make the time we have with them really effective in terms of skill acquisition and the things that we do. So there's 3 things you can use. The first one is description. The second one is direction, and the third one is distance. Okay. Now, what do I mean by? Let me give you a very practical example. Let's say, okay, you're trying to help somebody to sit to stand. Okay, post-surgically. Okay, for whatever reason. Okay, they are struggling with sit to stand. It's not because they don't have enough muscle strength. Okay, or range of motion or such like. It's actually this is very much a skill-related issue. Okay, so what you might use in terms of description, direction and distance might be, okay, what I'd like you to do is I'd like you to stand up, but I'd like you to stand up straight, okay, and push the ground away. So what we've got there is, okay, so we've got push, okay, which is rich in description. Okay, we've got direction, which is, because what we're saying is push the ground away. Okay, so and you might use something like that. Okay, if you wanted them to do it fast, okay, so if you were interested in their rate of force development, you wanted them to do that particular activity quickly, okay, because there was a reason for it, okay, maybe to stop them stumbling or whatever it may be, okay, you might change your description slightly, okay, and you might, change the inclination of your voice tone, but you might say, I want you to explode away as quickly as possible, okay. Hopefully that sort of makes sense. Okay, to give you another example, let's say, for example, we have someone who is, we've given them a ThyroBand, okay, because we want to improve their hip abduction strength, say, for example, or we want to increase their muscle cross-sectional area. Okay, we can talk about squeezing glutes and we can talk about lifting legs up towards the ceiling and such like, but actually maybe a nice way to do it is to use the description, okay, of stretch. Okay, what I want you to do is I want you to stretch that band. I want you to stretch that band. Come on, try and break that band. Stretch that band as much as you can. Well, what you see here is actually you've got description, okay, and there is also direction, because they'll be lifting the leg up towards the ceiling in order to stretch that band, especially if you're doing a hip abduction inside lying, say, for example. Now, we haven't talked about glutes, we haven't talked about legs, but essentially what we've done is we've given them an end outcome goal. Stretch that band as much as you possibly can. So hopefully you can see how actually an external cue can be used, okay, quite usefully. Okay, let's take, for example, a jump in. Let's say we have a okay, we're in our rehabilitation, okay, mid-stage, say, for example, someone that's injured their ligament, ACL, MCL, whatever it may be. And let's say actually as a part of our rate of development, okay, exercise prescription, okay, because we know that's important and we want to improve that, we're bringing in jump plyometrics, say, for example. Well, a simple way to improve their ability to essentially to jump upwards in a vertical direction, it might be something along the lines of, what I want you to do is to explode, there's our description bit, okay, up towards the ceiling and catch a ball. Yeah, so you've given them essentially description, you've given them direction, and you've also, to a certain extent, you've given them also distance. What about landing? Because landing technique's important as well, isn't it? Okay, and let's just say, for example, you're concerned about their landing technique, okay, then you might also give them some imagery around external cueing, such as, okay, what I want you to do, okay, when you land, okay, imagine your knees are like searchlights, okay. What I want you to do is I want you to keep those searchlights pointing forwards, okay, as you land. Yeah, so as they're landing, so essentially what you're doing is you're using the goal of searchlights, okay, and also direction, okay, in essence to improve their alignment without actually telling them, okay. The same thing could be, let's say, for example, you want them to land quietly, so you're interested in their force absorption, so you want them to absorb force, okay, rather than talking about, okay, well, what I'd like you to do is I'd like you to increase the amplitude in your knee, ankle, and also hip. No patient's going to do it. No patient's going to know what we're talking about like that. A simple thing might be to say, what I want you to do is I want you to imagine landing in a puddle, but try not to splash. All of a sudden, okay, the patient is now thinking, I've got this, okay, so they want me to land quietly. So automatically the patient will automate their response. Guess what? They're going to land, okay, with a large hip, knee, and also ankle amplitude, yeah, because they're going to try and decelerate those forces. Anyway, we're going to stop there. So hopefully you heard it here first, okay? External cueing, okay? It's the thing that we don't really do, but it's the thing that could make a real profound difference, okay, to the fortunes of our patients in terms of skill acquisition. Okay, so your call to action, okay, is to at least with one patient, okay, tomorrow, okay, to try and use some external cueing, okay, with your exercise prescription. Don't try and do it all because it's a journey, okay, so maybe just pick one patient and try and use that, okay, and obviously don't forget to join our community, okay, we'd love for you to join, okay, follow us, you know where to follow us, okay, we're on Twitter, we're on Instagram, and also we've got our website. Okay, thanks for listening, bye for now.